Welcome to the DoubleACS Daily News for July 31st, 2017. Sturdy Memorial Hospital will open up a new urgent care center tomorrow in South Attleboro. There was a brief open house last Thursday, and CEO Dr. Bruce Auerbach spoke with us about the new center.
This is the open house for our first urgent care center for Sturdy Memorial Associates and Sturdy Memorial Hospital. This is an effort to bring convenient care to our patient population base in a way that works for them, and also that ensures that the information that is both available to the providers in the urgent care center, as well as the primary care physicians and other physicians who normally care for these individuals, is consistently and readily available, because this center will be on our electronic health record. So when patients come in to utilize our services here, the providers will have access to the records from their physician's office, and likewise when they leave here, the physicians in their practices will have access to whatever took place here, so that it really provides a continuity of care and ensures that all the appropriate information is available, and that there isn't duplication of services, because they will know what has gone on before and what's happening afterwards. It's become increasingly clear that patients are looking for the convenience. We have many practices in and around our service area. They have somewhat more limited hours of availability, and in order to ensure that our patients have the ability to get care when it's convenient for them, we're opening this facility up. We will have a second one opening up in Plainville within the next several months. And we're doing it so that patients will have the ability during extended hours from 8 a.m. to 8 p.m. Monday through Friday, and 8 a.m. to 4 p.m. on Saturdays and Sundays, 7 days a week, holidays included, so that they don't have to wait for prolonged periods of time for more minor illnesses or injuries, and they don't have to go to the emergency department, which is more expensive, and where there can also be longer waits, because we're taking care of sicker patients, and the patients that come in with more minor problems obviously have to wait behind the patients that are sicker.
The urgent care is going to be staffed with a secretary, a medical assistant who will assist the provider that's seeing the patients, and then a provider that'll actually sort of evaluate and take care of the patients medically, and that can be either a physician, a nurse practitioner, or a physician assistant. And the appointments, so if you book online, you can book the appointments in 15-minute increments, so you can see up to probably 48 patients a day, and then you add in the walk-in patients that come in between. The urgent care is meant for patients mostly with minor illnesses and injuries, so sore throats, ear pain, cough, cold symptoms, minor injuries like ankle injuries, orthopedic type things, lacerations, sort of simple infections, simple skin infections. Obviously, anybody can walk in with symptoms, so they get assessed, and if it finds to be something that's more than the urgent care can handle, then they would get sent to a hospital if they need more evaluation and treatment. For patients that are within the Sturdy system, the benefit of coming here is that the medical records and the information is all contained within the system. So, for example, if you have a doctor that's a Sturdy doctor, but you can't go see them because their office is full, you can come in here, you'll get evaluated for your complaint, say it's a sore throat, there'll be a record documented of what happened, and that record will go to the doctor. So then if you don't feel better and you get an appointment 2 days later at your doctor's office, the doctor can say, oh, you were at the Sturdy urgent care, I saw that you got seen for a sore throat, they started you on an antibiotic, and so they know what happened 2 days ago, and they can then continue the treatment from there. Yeah, I think the urgent care is going to be a great addition to the Sturdy system. I think it, really is providing patients an alternative site for care and a place to get convenient care. It also really helps patients that work during the daytime, so they can get in to be seen. Doctors' offices oftentimes close at 5 o'clock, and people work till 5 o'clock. So now you've got time on the evenings and weekends to get the care that you need, and still stay within the system. Still stay within the Sturdy system. So I think it'll be great for patients, and I think we'll be able to provide a great service.
That's it for today's update. For DoubleACS News, I'm Austin Ricketts.